So changing that joint mechanic right away does stimulate nervous system cortical mapping right away, and we see that.
Even like fast twitch aspects of like small muscles,
Seriously.
multifidi closer by.
Study on multiffidi activation and how that short, fast twitch adjustment is one of the only ways to impact multiffidi recruitment, stabilization of the lumbar spine, all these things. But I think when we can start to understand that more, it's going to cause us to be more efficient and choose exercises, and outcomes for our patients will improve.
I love that. And
Yep.
yeah, thank you for explaining that. We're definitely opening up and increasing that range of motion, that area of where that gas is accumulating within the joint. So it's okay and safe if that happens more times than not. But that goes back to the other comment and that the point that when we're going through the fullest range of motion to control certain parts of that barrier, that signal, that area of tightness, that muscle guarding, if you stretch any area, so let's say we're going through our neck workspace, going back to this, we feel pop, it's okay, we're fine, no pain, no sharp pain, we're able to move in that range of motion. Maybe we have more tightness, moving our head in one direction, maybe looking down the armpit, and we'll feel muscle tension on the opposite side and where we rotate. From there, we want to connect the nervous system to the tissues. So we're already stretching, we're at length, we want to create almost like an isometric contraction or squeezing that muscle belly at range as everything's stretched. Those that aren't watching, you're looking down to your armpit, you're putting your same side hand that you're looking your head to, holding behind the head. So we're stretching, but we're creating a barrier. Now from there, you want to move your head into your hand, into the resistance. So we're stretching and then contracting the head back to the opposite direction, which contributes that muscle contraction. Thus, so the brain's communication at length is ramping up and your body's, okay, it's safe to move in this area. The more sessions, the more times you can ramp up that intensity, not only will build up the muscle belly, it actually has more of even a hypertrophic effect to where you can increase the size of the muscle belly, especially when you load at length or you contribute a muscle contraction as everything's stretched. And then even add in a functional movement that move with a muscle contraction. So we're keeping the resistance with your head going back into your hand, and then we're adding in a rotational movement. You're just changing where your hand is holding, but you're still trying to tilt and move into the area of stretch. So then you get all the muscle bellies and the motor units surrounding all these small areas of connective tissue to be stimulated, thus turn off some of the muscle guarding when you come back to neutral and center from there.
And that ultimately was what I was talking about regarding loading the tissue.
Yes.
And really what I focused on when I had really tight traps, which is very similar to what Dr. Jace was doing versus me just doing a simple stretch. So definitely ups your game in getting outcomes when you have issues. There are definitely other things that you can do, but that's pretty simple. A great simple way to get that to improve.
And I know there's one other tool that I think can help a lot of people. So we know we want to stretch and create contraction. Now let's say we want to utilize that. So again, for those people that aren't watching the video, let's say if your hand was closer to a wall or you're stretching and you're putting pressure into an external object, from there try to go into a stretch as much as you safely, comfortably can. So you feel that stretch reflex. From there, try to activate and bring your hand up off the wall into a hover. You're probably going to notice your body's going to tilt, lean away just to make it happen. But holding that without any resistance, but you're still stretching, forces an area of range of motion to where you can get into. Thus, going back to my point, if you notice popping, cracking, extremities usually have this more to where you're going to notice more stiff tissue tension going over loose connective tissue can create a pop gas release, or some people can think about it like a tendon moving over bone to a certain extent. If you go, let's say you have doing shoulder workspace, I notice a pop crack as I'm rotating my arm back to the side. From there, I would want to hold the arm into the wall. So we're stretching the area, the exact range of motion within about a 15-degree area, and then holding a stretch and then trying to lift up and then add in rotational movement around there. let's say 10, 15, 20 seconds, and then go back through. You're going to notice a little less popping. You add in multiple sessions, and you can open up the range of motion from there as well. So it's like hovers.
So you're stating for patients who have that kind of crepitus noise, that
Yep.
cracking noise,
Yep.
that can sometimes be taken away.
Yes.
And improved.
100%. Past injuries, not using it for a longer period of time. So the open up range of motion, you'll have to start targeting specific sections at the same time as you're targeting the deeper signal. So then we get the muscle bellies, we get the connective tissue of ligaments, tendons, but all at the same time as opening up that exact same area.
Nice.
So it's specific there, but
That's awesome.
yeah. So lift-offs, contractions at end range of motion, full specific joint movements through the fullest range of motion, and then creating that connection between passive and active range of motion opens everything up from there.
Awesome.
Yeah.
Yes.
Now, Doc, in terms of the fascia factor and understanding like the fascia's role, especially between different layers of tissue tension, so the epimysium versus the perimysium versus the endomysium, I guess what are certain things that you've seen with fascia?
Yeah, I think a lot of people don't realize just how neuroconnected fascia is.
Yes.
And when you hear this concept of what fascia is and how it encases muscle, it really is like a web. And it's everywhere in our body. And when you start to see dissections of fascia, it truly is its own organ and webbing and connection. The fascial trains that you'll start to peel off on the body is fascinating. So what I mean by that is there are what are called different specific webbings in our bodies of fascia.
Stated.
And there are different ones that you can have almost complete and quick connection to each other depending on where you are on that part of the train. So for example, the most common one that I like to talk about is the posterior chain. So if you were to take the fascia from the back of the head, you could take it all the way off and it'll go all the way down your back and all the way down your glutes, all the way down your hamstrings and go to your Achilles. That actually is one train of fascia. It's all connected. And when you think about that, you're like, how does that work? One way that I was shown how it's worked is, for example, you can do this at home. Let's say you have a tight hamstring, okay?
Yes.
So you test to see how much flexion of the hip that you can do. You want it about 90 degrees compared to the floor. And let's say you're at like 70 degrees, okay? Instead of foam rolling this side, foam roll your left side, the opposite side, okay?
Okay.
Do it for about 15 to 20 seconds. And then check the side that you just tested. And what you'll find most of the time is you'll gain range of motion. And you're like, how the hell does that work? And it's because through neuromuscular connection, fascial train stimulation, and connectivity between neurons, anywhere you stimulate along the fascial train, that communication will be sent. And so what really it comes down to is neuromuscular control, stimulation, mechanoreception along the entirety of the train will give you way more of an outcome than just treating that area.
Yes.
Same as what you were talking about when and we're not just going to work one area of the bicep. We need to work it all. And that's the same it goes with fascia. Is if we're going to work an area, same with the concept that we just talked about in the last podcast, which is if you had shoulder issues, it's not just sometimes the shoulder, sometimes it's thoracic spine mobility, sometimes it's inhalation, all these things. And it's the same when it goes to treating tension issues with fascia. So you want to treat the entirety of the fascia. If you have, let's say, low back pain, you want to start treating the hamstrings, you want to treat the calves, you want to treat the core, you want to start getting better engagement of the core in order to flex, to stretch the low back, all these things. And I'm keeping it quite simple. There's a lot more that goes into it, but this is just so you guys can understand what we're talking about.
And Anatomy Trains is a book that will breaks down all this.
Yeah.
There's not just posterior chain, like obviously what Doc said, easier to understand that way, but there's spiral lines of fascia. There's ones on the front, the back. There's different layers as well.
Yep.
That's also why when we look at patients, we have to look above and below the area due to compensatory or compensations.
Yes.
Because usually with that line of fascia, depends on where it's at, it'll have that similar communication aspect. and that usually is on a paramecium level, so between small different muscle bellies or fascicles, which also have a same route of fascial plane as that exact same tendon of that small muscle belly itself too. So then you get the Golgi tendon organs, you get the same time muscle spindles, which makes sense on why certain things in certain areas are connected.
Yeah. And the last point I want to talk on, I could talk all day on this, but I think we've already covered most of this. When we think about how fascia is aligned, it is encasing the muscle. It really is. It's surrounding the entirety of it. And fascia is very thick and is web-like, and it can respond to tension very well. And so there are times where it is in a tense state. And so think of it like this. Let's say you have a stretchy substance, but you encase it in a very thick, hard substance.
Yes.
And you're like, how do I get the stretchy substance to actually stretch? Well, you can't. You never will. And that's where this I need to stretch my muscle concept needs to be eliminated, because how you get the muscle to then improve its length has nothing to do with stretching it. You need to load the area, because fascia especially responds so heavily to load.
Yes.
That is what then can reduce its tension by loading that area, neuronal input. So one of the studies that I liked talked about this. It said that fascial stiffness correlates with movement restriction because dynamic loading, not static stretching, reduces fascial tightness. So this is everything that you now talked about with, if we're going to improve flexibility, we got to start with the joint, because there's just so many neuronal inputs to the joint.
Yes.
Among all the other reasons why we'd want to work the joint. But let's say the joint becomes much more improved, but we still have tension. Now it's how do we load the tissue, probably also loading the fascia at the same time to improve what we need to improve. And that, again, all comes from a neuromuscular control, motor units, all these things that we're talking about.
100%.
And I think it's how we change the thought process of treating patients as providers, but also as patients, to how to help your own self when you have issues like this.
And I know I can hear these comments coming out already, to where static stretching has helped for other individuals. And we're not arguing that. We're saying that there's different, better ways to utilize your time and resources, because static stretching has been shown to induce osteoblast formation, to more or less build up certain areas of bone, certain areas of muscle tension, but a lot of it comes from the signal itself. So there is a time and place to go into static stretching, but there's better utilization of resources thereof. So like there you can, but I'd rather go into active mode.
We're missing a lot of the picture.
Yes.
Just using that modality.
Well stated.
Yeah.
There's just something small that I can hear the comments already on
And
that.
as far as moving the needle, it's just not what you want in any real part of the process when we're trying to really help rehabilitate a lot of these patients. So,
100%.
And then the last thing I just wanted to tie it to yours, was this principle that the joint capsule is king, because fascial chains connect to capsular structures. And so mobility drills always must be needed to engage the full kinetic chain from joint to tissue. And again, how fascia responds to neurological signaling. Threat reduction techniques can even enhance fascial compliance, improving joint structure and reducing neurological tightness, improving strength, all these other things.